Your CNOS Health Watch on Siouxland News.
November is Epilepsy Awareness Month. Siouxland News reporter Katie Link went to CNOS to learn more about the illness.
So epilepsy is a very common neurological condition. It affects almost 3 million Americans. And even more importantly, about 1 in 10 people can be affected by a seizure during their lifetime.
Dr. Elizabeth Hartman is a neurologist at CNOS. She tells us a seizure happens when too much activity in the brain disrupts normal activity.
Epilepsy means a person has had more than one seizure in their lifetime, and also that they're at risk for having more seizures in the future.
But it's more common in the young and old.
Many different types of seizures. The most common type of seizures that people think of are what we call grand mal or generalized tonic-clonic seizures. This is when a person loses consciousness and has shaking and stiffening of all of their extremities. And often it can look very violent and very scary.
That's why it's important to know what to do if you see someone having a seizure.
The best thing to do if you see someone who looks like they're having a seizure is go and check on them, have someone call 911, and if possible, you want them to be laying down on their side in a safe position.
And you can forget any of those myths you've heard.
You do not want to try to put anything into their mouth. You do not want to try to maneuver them, but you just want to let them lay in a safe position if possible. So move things that may be sharp away from them until the seizure stops.
Dr. Hartman says seizures last just a few minutes. It's best to keep patients as calm as possible until help arrives because they may be disoriented when they wake up. For Siouxland News, I'm Katie Link.